I think with pain is a huge feature of dementia that goes unrecognised, and quite often behaviours of concern relate to pain, and to the point that I would say assume pain before anything else. It's a useful assumption to make at times. With pain, you'll get signs that are not necessarily articulated. Sometimes a person will tell you they're in pain, depending on the level of dementia, but very often their behaviour will suggest that they're uncomfortable. Pacing can often be related to pain, restlessness as well, and certain behaviours of concern, again, could be because the person is feeling pretty wretched and they are just on the go. If you look at a person and they seem uncomfortable, it's a good indicator of pain, much more than if you ask them. If you say to people, are you in pain, they'll often say no. They might not have understood the question, and no is always a safer answer to a question for somebody with dementia, because it means that nothing will happen after a no, whereas something will happen after a yes, and it's the something that will scare them a bit. I tend to touch people in places and say, does it hurt here? Does it hurt? And see what their facial reaction is, and I might ask if they're uncomfortable rather than if they're in pain. These, when you're looking at the face of somebody, you'll see signs such as a scrunching up of the face, biting of the lip, touching certain areas of the body, perhaps a slight limp, or perhaps not using one arm or the other. These will give indicators. The other thing to be mindful of is if the person had arthritis before they had dementia, they're going to have arthritis after dementia, and sometimes painkillers are not thought of, whereas really the person is going to be in the same sort of pain that they've always been in. So if you have somebody who's had chronic pain, they're still going to have pain after the dementia. It won't go anywhere. So it's important to make sure that the painkillers are the first line of defence.